Hello, and welcome to this presentation on the impact of outcomes-based commissioning on the third sector in adult social care services. My name is Javed, and while I currently work for the Health Foundation, this research was conducted for my dissertation for an MSc at Birkbeck. Studies have identified a number of pressures on the third sector as a result of traditional outputs-based contracting, including coercive isomorphism, increased formalization, and mission drift. Additional studies have shown that in relation to this, the third sector would like to be more involved in the design as well as delivery of services, work in greater collaboration with commissioners, and work with less restrictive or alternative performance monitoring measures. Coinciding with this has been the development of outcomes-based commissioning. Outcomes-based commissioning means the involvement of providers in designing, procuring, and delivering services to achieve desired outcomes. This can be achieved through personalization of services in adult social care, for example, with greater user involvement and engagement in designing individual services and interventions to improve quality of care. Outcomes tend to be less volume or task-based than outputs, for example, the number of beds filled, although these may form part of the overall services provided and service evaluation. Beginning with the Our Health, Our Care, Our Say white paper, which included the principle of practice-based commissioning in health, there has been a series of policies introduced by successive governments which have built on the same rationale of increased personalization, person-centered care, and co-production focusing on improving patient-reported outcomes in social care. There's also been a greater push towards greater localization and collaborative working between local authorities and providers, in addition to encouraging and adopting innovation and potentially finding cost efficiencies and cost savings. Outcomes-based commissioning sought to refine the relationship between commissioners, providers, and service users, creating a less hierarchical and linear structure, providing users with more say in the services they receive, and giving providers more say in the services they deliver by being more involved in the design and having a closer relationship with the commissioner to be able to focus service on the local need. There has, however, been little research on what this relatively novel approach to social care services has been on the third sector in relation to those existing around the impact on commissioners. Through this exploratory study, I conducted interviews with a small cohort of stakeholders from within the third sector with experience of working in outcomes-based commissioning in delivering adult social care services. This study sought to understand how outcomes-based commissioning had impacted on their relationship and partnership with local authorities, the communities that they serve, as well as other partners and organizations, in addition to understanding how outcomes-based commissioning impacted on their organization, and as well as understanding how it impacted on the services that they provided. Findings from these interviews show outcomes-based commissioning is very much a relationship-led process, with improving lines of communication and a greater awareness of the costs and challenges of services for both commissioner and provider through this improved line of communication. There was also greater innovation and intersectoral partnership and different ways of working, particularly for those working under an alliance model where multiple providers work together under a single contract with local authorities to deliver a range of services. This not only led to shared risk and responsibility, but also more innovative ways of working, including different ways of sharing resources, skills, and training for staff at different stages of the patient pathway across organizations to improve the quality of care and the standard of care for patients and improve their overall outcome. Participants also reported less isomorphic pressures and less restrictive monitoring processes under outcomes-based commissioning because of their greater involvement in the earlier stages of the commissioning process, as well as the less prescriptive means of contracts. However, there were variations across the different types of service, with care homes still finding particular struggles found under outputs-based contracting as they did under outcomes-based contracting. Variations also existed among local authorities within the same region, particularly around finding commissioner engagement and buy-in to make outcomes-based commissioning successful and effective. What some of these findings may mean for policy and practice, particularly for the third sector and by extension local authorities, is that there is a greater awareness of the challenges and improved understanding of the real cost of services, both for commissioners and by commissioners, as well as greater innovation and partnership working across providers. However, challenges do remain, in particular those around the commissioner, gaining their buy-in and engagement, as well as finding capable commissioners who are able to change the culture of the council that they work in and traditional ways of working, and to be willing to be able to work in an outcomes-based model with providers. Thank you for listening. If you have any questions or comments or feedback, please do not hesitate to get in contact.